Scientific Sessions is really the Super Bowl for cardiovascular science and cardiovascular care across the year. This is where all of us come together, clinicians, scientists, all levels of career stage, to understand the latest and greatest science. And this year, we're particularly fortunate to have many large, important, paradigm-shifting clinical trials being presented. Included in the roster of clinical trials will be very new drugs where we'll get a sense to see whether they can prevent or treat heart failure patients, a really vexing problem that leads to multiple hospitalizations and early death. We'll look at whether a brand new drug can treat heart failure, whether simple iron supplementation actually might improve heart failure outcomes, and whether a new a member of a class called SGLT2 inhibitors will actually continue to show us these dramatically wonderful effects in preventing heart failure hospitalizations. So lots of excitement there. Continued excitement around new opportunities to control the bleeding system to make sure that patients with heart stents and heart valves don't develop strokes or blood clots. So we'll learn a lot there that I think will change practice. And then very importantly, we're going to learn about this newer concept of a polypill, a pill that contains 4 different drugs just in one tablet, and whether that's an effective approach for preventing first heart attacks and strokes. So rather than having 4 separate drugs and dialing the doses up and down, can we just give you one pill that has a fixed dose combination of all those drugs? And is that a cost-effective way to prevent cardiovascular disease in large populations? So we're looking forward to seeing the results of trials around that as well. And finally, the last thing I'll highlight is a trial that's very small, but very important. I think we all have heard that statin medications, they're cholesterol-lowering medications that are quite commonly used, but sometimes in about 5 or 10% of patients can cause muscle aches, and that can limit our ability to use those drugs. Well, this trial called the SAMSON trial actually used a novel design where they gave people an empty pill bottle for 4 months, a pill bottle with a placebo or sugar pill for 4 months, and a pill bottle with a statin medication. And these were all patients who had had side effects. And what they found, interestingly, was that the placebo caused just as many side effects, essentially, as the statin medication did. So I think this tells us that the act of taking a pill, being treated, if you will, as a sick patient, really does cause side effects, and it's not only medications that can cause side effects. So I think that will help patients understand how to tolerate these very important medications better.